I'm Susie. I am a women's health and certified IVF nurse. And today I want to talk to all of you about preparing for IVF, in vitro fertilization. IVF is one of the most overwhelming and daunting experiences in human life. It's not something we learn about in our middle school health class, and it's not something we talk about in college or maybe even after. Unless you've had a family member or a good friend who's very open about talking to their experience, you probably don't know much about IVF. In this video, we're going to cover your IVF checklist. That means all the workup you have to do at your clinic. And then we're going to talk about how to prepare for working with your fertility clinic and going through the IVF process and procedures. I'm also going to create some follow-up videos that talk about the specific procedures themselves. So be sure to follow along and watch the other videos in this series. By the time you and your partner, or just you, have gotten to the stage of we're going to do IVF, it means that you've likely been working with your fertility clinic for a little bit of time, meaning you've already gotten a good amount of workup done in order to move to the next stage, which is IVF. So I want to quickly review what that workup entails. All right, the first part of this workup is a new patient visit with your provider. You've probably already had that. Then you're going to go through a whole slew of tests. These include your cycle day 3 blood work to check your ovarian reserve. You're going to have a baseline ultrasound to look at all those premature eggs in your ovaries and get a good picture of your uterus. Then you're going to actually do an X-ray dive test called an HSG. This is going to see if your tubes are patent or if you have anything blocking them. Next, we want to do a cavity evaluation. This is going to evaluate the uterus and give us a little bit of a better image than just an ultrasound. We also want to make sure that you and your partner, if you have one, have done your STI and ID lab workup. Since we're going to be creating human embryos in a lab using your egg and a partner's sperm, it's really important that we have all of this workup done per FDA guidelines. There might be some other parts of the workup, but that's the primary baseline for starting IVF. After your workup, you should have a repeat patient visit or a consult with your doctor to review the next steps and your protocol for going through IVF. Every patient has what we call, in the world of reproductive medicine and IVF, a protocol. This is where we identify which medication regimen we want you on per your body. We can identify this from that workup you did, including your ovarian reserve and your cycle day 3 blood work and your age. After your doctor identifies the right protocol, you and your partner, if you're working with one, have a lot of big decisions to make. This includes what type of fertilization you would like to do during the IVF process. There are 2 ways of doing this. We have conventional insemination and we have ICSI, or intracytoplasmic sperm injection. Both are great options, but you need to work with your physician to determine what's right for you as a couple. Next, you might be faced with the decision of testing your embryos. This includes something called pre-genetic screening. Today, in the year 2021, most couples going through IVF choose to do pre-genetic screening. It's really helpful to identify a healthy embryo before we transfer it back into your uterus. It can decrease the chance of miscarriage. And if you're going through IVF for genetic reasons, this is a very valuable tool and test to use, and you should work with your doctor to determine if it's correct for you. After you've met with your doctor and made some of these critical decisions, now it's time to meet with the rest of your care team at your IVF clinic. You've probably been paired with an IVF nurse. Your nurse is going to be your cheerleader and coach and teacher throughout the whole process. So it's really important to make sure you have a good relationship with them, or get partnered with a different nurse who you like to work better than the one that you're paired with. It's always okay to do that. What we want to make sure is that you're going to have the best experience and that communication is sound between the clinic and you and your spouse. Your nurse is going to go through that IVF checklist with you and make sure that everything is completed. At this time, they're also going to do injection training. IVF includes a lot of medications. For some people, it's just oral. For others, it includes a lot of injections. And your nurse is going to teach you how to do all of those injections yourself or teach your partner how to do them for you. Next up, the medications themselves can be very confusing. Ask your nurse to give you a checklist of all the medications that you're going to have prescribed to you and work with them to identify the correct IVF or specialty pharmacy that you need to order these from. Lots of couples or individuals may or may not have insurance coverage for IVF. Before you start IVF, you've probably gone down the rabbit hole of insurance. So just because you have insurance coverage for the procedure itself doesn't mean you're going to have medication coverage. Medication coverage is often completely separate in your medical plan from a procedure. So work with your nurse or the person at your clinic who's responsible for checking insurance coverage to see where you're capitated to order your specialty drugs from. I will say it's important to note most people in the United States sadly do not have insurance coverage for both IVF or the medications. It often comes down to our employer plan where we get our insurance, or it comes down to the state that we live in and if it has a mandate for fertility coverage. So if you do not have insurance coverage, these drugs can cost anywhere from $5,000 to $10,000 per IVF cycle. Once you've identified the pharmacy that you're going to, make sure that you get a checklist of your drugs from the nurse. And when you get those medications, either via shipping or if you are able to go to your specialty pharmacy and pick them up by hand, go through that checklist line by line and identify and make sure that you have every single drug that you're supposed to have. This is one of my favorite things that I used to do with my patients, and I actually used to make them come into the office with their medications and I would go through it with them. I was super paranoid about making sure they had everything they needed to optimize their IVF cycle and that we weren't missing a thing, so it goes smoothly. Next, your clinic might require you to do an IVF webinar. It's really important that you attend these events or go through the things that your clinic has asked you to do. There's probably a reason for it. We want you to be informed when it comes to this procedure because it is such a big deal. You're going to be taking medications and you're going to have a surgical procedure to remove the eggs. So make sure you attend any of those events or watch any of the videos or webinars that they ask you to watch. Another thing I like to bring up with patients is to seek out the help of a licensed mental health professional. IVF, like I mentioned in the beginning, is very overwhelming. So as you're going through the path to prepare for your IVF cycle, if it's helpful to you, make sure that you seek out a therapist if you want to, or look for a fertility support group in your area. If they have one at your fertility clinic, that's amazing. You should sign up and do it. It's really helpful, and it might make you feel a little bit less alone during this process. Don't forget that you're starting the next chapter of your life. Some of you might have been trying for a long time, and I hope that IVF leads you to the success in building your family that you've been looking for. So many of us struggle for years, and IVF can feel like the exciting next chapter. So just remember to always hold hope, hold on to that excitement. Talk about it with your family and friends if you want to. Build an open dialogue with your spouse about the process. And don't forget, we are here at Binto to support you along the way. We have a whole group of fertility nurses here on our team, and you can schedule a consult to go over any of this at any time. You can visit us at mybinto.com and book your telehealth consult today.